CNA practice test online free. Question 1. What is the proper method for cleaning the perineal area of a female resident? From back to front, from front to back, in a circular motion, with a scrub brush. Cleaning from front to back, cleanest to dirtiest, prevents the spread of bacteria from the anal area to the urethra. Question 2. Which document describes the tasks a CNA is legally allowed to perform? The resident's care plan, the CNA's job application, the state's scope of practice, the facility's menu. The scope of practice defines the legal limits and responsibilities of the CNA role in that state. Question 3. When communicating with a hearing-impaired resident, the CNA should shout as loudly as possible, speak slowly and face the resident directly, only use written notes, avoid talking to them. Facing the resident allows them to see your lips and facial expressions, and speaking clearly helps communication. Question 4. If a resident is in a vest restraint, how often must they be checked? Every 15 minutes, every hour, every 2 hours, once per shift. Residents in restraints must be monitored at least every 15 minutes to ensure safety and circulation. Question 5. How often should a resident who is unable to move be repositioned? Every hour, every 2 hours, once per shift, only when they complain of pain. To prevent pressure ulcers, immobile residents should be repositioned at least every 2 hours. Question 6. A resident is choking and cannot speak or breathe. What should the CNA do? Perform the Heimlich maneuver, abdominal thrusts. Offer the resident a glass of water. Wait for the nurse to arrive. Hit the resident on the back. Abdominal thrusts are the standard emergency procedure for a conscious person with a complete airway obstruction. Question 7. Which pulse site is most commonly used for taking a routine pulse? Carotid, radial, brachial, apical. The radial pulse, at the wrist, is the most common site for measuring heart rate in adults. Question 8. What is a common sign of a urinary tract infection, UTI, in an elderly resident? Sudden confusion, increased appetite, better sleep, improved mobility. In the elderly, UTI is often present with cognitive changes or delirium rather than just physical symptoms. Question 9. If a CNA sees another staff member hitting a resident, what is the first action to take? Call the police immediately. Stop the abuse and ensure the resident is safe. Report it at the end of the shift. Ignore it if it doesn't happen again. Safety is the priority. The CNA must intervene to stop the abuse immediately. Question 10. A resident with Alzheimer's disease is wandering the halls. What should the CNA do? Lock the resident in their room. Tell the resident they are being naughty. Gently redirect the resident to a safe area or activity. Tie the resident to a chair. Redirection is a safe and effective technique for managing wandering behavior in dementia patients. Question 11. Which of the following is an example of objective data? The resident says they have a headache. The resident's blood pressure is 120/80. The resident feels nauseous. The resident is worried about their family. Objective data is observable and measurable information, such as vital signs. Question 12. When measuring a resident's blood pressure, the first sound heard is the diastolic pressure, pulse pressure, systolic pressure, mean pressure. The systolic pressure is the top number and represents the pressure when the heart contracts. Question 13. When dressing a resident with a weak right arm, which arm should be dressed first? The left arm, the right arm, both arms at the same time. It doesn't matter. When dressing, always start with the weak or affected side first. Dress affected/weak. Question 14. Which of the following is a sign of dehydration? Clear, pale yellow urine. Moist skin. Dark, concentrated urine. Increased appetite. Dark, strong-smelling urine and low output are classic signs of dehydration. Question 15. A resident is nearing the end of life. What is the CNA's primary role? To encourage the resident to eat a large meal, to provide comfort and emotional support, to discuss medical treatments with the family, to ignore the resident since they are dying. Palliative care focuses on comfort, dignity, and support for both the resident and their family. Question 16. A resident's tray has a full glass of water, but the resident is on NPO status. What does this mean? Nothing by mouth. Next patient only. Needs physical observation. Nutrition per oral. NPO stands for nil per OS, meaning nothing by mouth. No food or water should be given. Question 17. What is the first step in performing any procedure on a resident? Gather supplies. Identify the resident. Wash your hands. Explain the procedure. Hand hygiene is always the first step to prevent infection before touching a resident or equipment. Question 18. What is the correct way to lift a heavy object? Bend at the waist and keep legs straight. Keep feet close together. Bend at the knees and use leg muscles. Lift with your back muscles. Proper body mechanics involve using the strong leg muscles and keeping the back straight to prevent injury. Question 19. What is sundowning? Increased confusion and agitation in the evening hours. Sleeping all day and staying up all night. A skin condition caused by the sun. The resident feeling better at the end of the day. Sundowning is a phenomenon where confusion and behavioral problems worsen as daylight fades. Question 20. What is the primary goal of restorative care? To perform all tasks for the resident. To help the resident regain or maintain the highest level of function. To cure the resident's illness. To move the resident to a hospital. Restorative care focuses on helping residents maintain or regain their independence and physical function.